My name is Tiffany Law. I am the program manager with the Inland Empire Community Health Initiative. My field right now is within nonprofit healthcare, specifically around the education, enrollment, and support for the communities of Riverside and San Bernardino County. My past experience has been in program management over education and in supporting children with autism through ABA therapy. So I am managing the programs that are better supporting the implementation of our strategic plan and better supporting the communities that we serve, specifically through our Rural Health Task Force that is covering 6 regions throughout the Riverside and San Bernardino counties that we are finding are in dire need of additional services and just a spotlight on the supports that they need when it comes to access to healthcare and access to health justice and health equity. So whether it be through transportation, access to food, and specifically Medi-Cal enrollment services. So when it comes to fostering culturally safe and specifically person-centered care, our role within the IHI is a little bit different than a traditional direct service support. So for the grants that we offer, we are currently doing a 1 through CMS that is a healthier kids option. And this is specifically around enrolling children, parents, and pregnant individuals into Medi-Cal and getting them the support and utilization services that they need to create a healthier IE. But more specifically, my role as program manager is to manage our subcontractors who are doing that boots on the ground enrollment and outreach-based support. So when it comes to fostering culturally safe and person-centered care, I do that through the support of the subcontractors and their enrollment-based teams. So year-round, I'm providing support to our subcontractors through semi-annual strategy meetings where we are providing a safe space for them to talk about issues that they're having with different organizations or through county offices and helping to mend some understandings of what the processes are. So in previous semi-annual strategy meetings, we have met with San Bernardino County Medi-Cal offices to better understand what the process is when someone submits an application, how we can better provide the applications, what necessary documentation that they need so that it is a more smooth process. And then having kind of an ear on the ground in how applications can be processed maybe quicker or what ways we can do to better support the county offices, and then relaying that information, providing that information back to the subcontractors who are doing that direct service support so that they know how best to amplify their concerns and what they may need. The clients and the applications can take up a lot of time. So getting out into the community can be sometimes really difficult, especially in trying to partner with different agencies so that these agencies know where they can go, who they can speak to when it comes to a random question that comes up that's outside of their wheelhouse and has to do with healthcare or health insurance or health coverage. So a lot of the work that we do is doing those meetings, going to those shared spaces, whether it be collaboratives or such as the IHP community partner meeting, any kind of meetings where there's going to be other paraprofessionals there who may have questions around health coverage, but they don't necessarily know that there is someone within their community that can help. Truly what I have found is just taking things really slowly. I think we are currently in a rush every day when it comes to work, when it comes to family, when it comes to connecting with friends. So they are receiving all these tangible needs that they can take away. So whether it be their new benefits card or whether it be a list of resources, right? But we often neglect the power of just sitting, fellowshipping, and meeting people exactly where they are. And I find that in my role, as I do, again, not do direct service work with clients, that I can provide this in support sessions with the subcontractor staff that I do work with. So whenever I meet with our subcontractor staff, I create and foster this environment of going into every conversation with an emotional, a physical, and a mental check-in. And I encourage them to do this with their clients as well. And truly, just by centering every meeting around the person that you're there to serve, you can very easily find yourself providing that person-centered and culturally safe care without even really thinking about it. So making sure that you are tailoring your meetings, you are crafting your meetings to not only be safe spaces, but be about the other person. It can create a helpful space for vulnerability to come very naturally.